Pharmaceutical and Medicinal Chemistry, Module 5, Pharmacodynamic Drugs, Chapter 5.3, Diuretics, Synthesis and Applications of Furosemide. Good morning, one and all. In today's class, we are going to discuss about diuretics, a class of pharmacodynamic drugs, their synthesis and applications. The outcome of this topic is to identify the importance of dosage of a diuretic drug, preparation of furosemide, medical advantages of furosemide and its applications. The contents of this chapter are as follows. Diuretic furosemide, its structure and synthesis, dosage, medical benefits, side effects, drug-drug interaction. As already learned, let us quickly go through the introduction of pharmacodynamics. It is the study of mechanism of action of drugs and explain what drugs does to the body and how it does it. It provides information about the use of drug and design of an effective drugs. A drug's activity may change due to a disorder, aging process and other drugs. Now let us discuss about diuretic drugs. Diuretics. Diuretics are drugs that increase the flow of urine. Diuretics promote the removal of excess of water, salt, urea from the body. They help the body to get rid of the excess fluid edema that accumulates in the tissue, resulting in various diseases. Diuretics interfere with reabsorption of salt and water by the kidney, but instead of being reabsorbed, the salt and water are ultimately excreted, thereby increasing the flow of urine. Classification of diuretics. Diuretics are classified according to the mechanism of action and according to the site of action. According to the mechanism of action, diuretics are again classified as carbonic anhydrase inhibitors. Potassium sparing diuretics, osmotic diuretics and secondary diuretic. As diuretic involve a transport of chloride, the class of diuretic which involve the active transport of chlorides are thiazides, thiazide related compounds. And loop diuretics. Loop diuretics are diuretics that act on the sodium potassium chloride cotransporter along the thick ascending limb of the loop of Henle in nephrons of the kidney. What is this loop of Henle? Loop of Henle is a part of the nephron in the kidneys. It is found in the medulla part of the nephron. Its function is to reabsorb water and important nutrients in the filtrate, thereby conserving water from the organism and producing highly concentrated urine. Some of the examples of the loop diuretics are furosemide, butanamide, torsemide, which are sulfonamide derivatives. This is the parts of nephron and this is the loop of Henle. Now let us discuss about furosemide, a loop diuretic. Furosemide. Furosemide is a potent loop diuretic that acts on the kidneys to ultimately increase water loss from the body. It is an anthranilic acid derivative. It is used to treat edema due to heart failure. It is also used for the treatment of high blood pressure. Furosemide is given to help treat fluid retention and swelling that is caused by congestive heart failure. Structure of furosemide. Synthesis of furosemide. Furosemide 4-chloro-N-furfuryl 5-sulfamyl anthranilic acid is synthesized in a relatively simple manner from 2,4-dichlorobenzoic acid, which is converted into 5-amino-sulfamyl 4,6-dichlorobenzoic acid during subsequent reaction with chlorosulfomic acid and ammonia. Reacting this with furfurylamine gives furosemide. Second method for the preparation of furosemide is 2-fluoro-4-chloro-5-sulfamyl benzoic acid on treatment with furfurylamine gives furosemide. Mechanism of action as diuretic. Furosemide, like other loop diuretics, acts by inhibiting the luminal sodium potassium chloride co-transporter in the thick ascending limb of the loop of Henle by binding to sodium potassium chlorine transporter, thus causing more sodium chloride and potassium to be excreted in the urine. Dosage. The dosage may vary depending on the age of the patient. For adults, initially 20 to 80 mg once in a daily single dosage is advised. For children, an initial dosage of 2 mg is preferred. 2 to 6 mg of dosage may vary depending upon the body weight of the children. Therapeutic uses. Diuretics are commonly used to treat high blood pressure. They are also used to treat fluid retention due to heart failure and kidney problems. They can relieve symptoms of edema in your lungs, legs, or abdomen. The half-life of furosemide is approximately 2 hours, and the total time of therapeutic effect is 6 to 8 hours. However, the half-life of furosemide will prolong in patients with chronic renal diseases. Adverse effects of furosemide. Hypokalemia means low blood potassium levels. Hypochloremia is an electrolyte imbalance that occurs when there is a low amount of chloride in your body. Hyponatremia, when the level of sodium in your blood is lower than normal. Hypocalcemia, levels of calcium in your blood are low. Hypomagnesemia, low level of magnesium. Hypotension, low blood pressure. Metabolic effects of furosemide. Hyperuricemia is a condition of elevated serum uric acid level in men and women. Hyperlipidemia, elevated levels of lipids like cholesterol in your body. Ototoxicity is a condition when a person develops hearing problem due to a medicine. Hepatotoxicity is a damage to the liver. Allergic reactions of furosemide. Dermatitis, a medical condition in which the skin becomes red, swollen and sore, sometimes with small blisters resulting from direct irritation of the skin by an external agent. Eosinophilia, presence of too many eosinophils in the body. An eosinophil is a part of a group of cells called WBC. They are measured as a part of blood test called complete blood count. Interstitial nephritis is a kidney disorder in which the space between the kidney tubules becomes swollen. Drug-drug interaction. Antibiotics. Antibiotics can increase the risk of hearing damage or loss when taken with furosemide. Anti-seizure drug. Taking this drug with furosemide can decrease the effects of furosemide. Cancer drug. Taking this cancer drug with furosemide can increase the risk of kidney problems and hearing damage or loss. Therefore, we can conclude diuretics as they work by causing the kidneys to excrete increased amount of salts and water from the body, resulting in a decrease in plasma volume and volume of blood, which in turn reduces the pushing on the artery walls, reducing stroke volume and blood pressure. Thank you.